Brunswick Medical Center and improving their strategy and facility growth. They are a fairly new hospital. They overtook the Brunswick Community Hospital in 2011, which we'll talk about a little bit when we get to the background of Novant Health. On the mission, vision, and values. The mission is Novant Health exists to improve the health of the communities one person at a time. The vision, this is, for current and for future. The Novant Health team will deliver the most remarkable patient experience in every dimension, every time. And the values, what they hold themselves and their employees to: compassion, diversity, and inclusion, personal excellence, teamwork, and courage. I'll leave this here just so you can read over their values a little bit more, because it is an important part of the company and what makes them a good company. Okay, moving on. So what to expect during this slide show will be the background. We'll discuss briefly external and internal analysis. Financial snapshot, we'll take a look at that. We'll look at the strategy implementation, and then we'll conclude with what this will bring for Novant or to Novant if it is followed through with. Real quick, a background or history on Novant. Novant Health was formed in July of 1997. The Brunswick Community Hospital actually had already existed before Novant took them over in 2006. But in 2006, Novant merged with Brunswick Community Hospital, renamed it Novant Health Brunswick Medical Center, and then in 2011 they changed locations, probably only about 5 or 10 miles down the road, into a brand new facility. So real quick, let's touch on the analysis. We'll look at external and internal. So externally, Brunswick County is the fastest growing county in eastern North Carolina. Most of that population being the geriatric community, which is 65 years and older. So according to the North Carolina Census Bureau, in 2010, Brunswick County went from 107,431 as population to 126,953 in 2016. And the population of 65 years and older jumped 7.9% of that growth. Unfortunately, though, for all of those geriatric patients in Brunswick County, Novant Health has no geriatric specialists on staff. They have family medicine practice and general physicians, general medicine, but they have no specialists for geriatric care. New Hanover, which is not in Brunswick County, it is in New Hanover County, but New Hanover Regional Medical Center has 2 on staff that you can see, for that 65-year and older age group. They can see specialists at New Hanover, which isn't too far. I think it's about 33 miles from Novant Health, which kind of just moves a little bit of the competition, gives Novant Health a disadvantage on their community, who they're supposed to be taking care of. They can't reach that part of the community because they don't have those specialists on hand like New Hanover does. Internally, Novant Health Brunswick provides 17 services. The basics, the emergency room and surgery. They do provide specialized care and teaching for diabetics, and they do orthopedics. But like mentioned previously, they do not have any type of geriatric specialties internally to provide to the elderly community that surrounds them. And internally, that specialized care would really work with the mission that they have. We talked about reaching the community and making the community healthy one person at a time. It's difficult to do that if you can't reach majority of the community, that is the elderly population. So financially, Novant Health does pretty well for itself. 90% of Novant Health sources of revenue come from outpatient, inpatient, and emergency services, which is obviously the majority of the facility. There's routine services and other operating revenue that it holds up the other 10%. According to Novant Health in their 2016 annual report, their revenue was just over $4.3 million. So they have the means, obviously, to provide additional services. It's just a matter of taking control of what they should do as a hospital for growth and for smart strategy as a hospital. So implementing this strategy, if they should, find that it is one that would benefit them long term, would be a long-term advantage in the financial aspect of it, the mission aspect of it, just in general for their community. They should start obviously with hiring a geriatric physician, not just any physician or not just any geriatric physician. They need to find somebody who meets their goals, who understands their values and has a standard for how they will take care of the patients in the community. It may not be a short process or an easy process, but it is an important process, especially if you want to provide this specialized care to those who live in Brunswick County. Second implementation would be patient planning. The hospital and then the physician who is hired should have an action plan for the services available. Will this physician only take care of the 65-year-old and older community? Will this physician take on additional patients when they are acting as, when they are on the floor? Will they have a separate office for the elderly community to come and become maybe not their primary physician, but that for that specialized care, the hospital and that physician should sit down and make a plan together. And then obviously, which is very vital, marketing. Community outreach is probably the most sought after or important, I think, of these. You go out into the community that you want to support. You go out into the community that you talk about in your mission. You go out into the community that surrounds you and will be the ones, supporting this specialized care. And you let them know it's what you provide. You let them know how you can help. You set up park days or trailers or times when they can come and have that one-on-one specialized care for that 65-year-old community and older community. Obviously, other ways would be commercials, billboards, all types of marketing, obviously, but community outreach when you're providing something specific to a specific hospital or to a specific community like Brunswick County. Community outreach is vital in that marketing strategy to make sure the community knows what you do, why you do it, and how you're able to provide that to them. Just knowing that they have that option closer than they would if this was not available. The conclusion would be this strategy obviously would meet the fundamentals of Novant's mission, vision and values. Mission mostly, reaching the community, as well as having an advantage over competitors. They would obviously fight closely with New Hanover, although they're not in the same county. But they already have that specialized care provided. But other hospitals like Dozier and even some as far as South Carolina, who don't have this as an option, people were willing to drive to those locations, then now they won't have to. You'll have that specialized care right there, close to home, so to speak, close to the community. This will provide community health, which is obviously a goal or almost a duty of a hospital to provide to the community it surrounds. Growth and financial stability, both are very important. This will, grow the patient foundation, bring in more finances, gives you the option to even expand this type of program, so to speak, add on more specialized physicians, whether it be another geriatric physician or some other need the community has that you need to meet as a hospital. Long term, this isn't just going to, you know, go away overnight. This is a long-term financial and growing strategy that will work for the community. And then finally, patient satisfaction, which is obviously vital with or without the specialized care, but with the specialized care gives that additional boost of patient satisfaction. Instead of a 65-year older group coming to the hospital for something and seeing a general practicing physician or a family medicine physician, they get that person who they really feel knows what they're talking about, what they're doing, knows what the patient is going through. So having that is just a little extra boost of patient satisfaction for the hospital when you can go and see somebody and know that they will take care of you because they have that specialty. This is just a cute little picture of me when I worked at Novant Health. I think it was Patient or Employee Appreciation Day. I'm not really sure what it was, but I figured I'd add it in to the slideshow. It's a really great facility, and they do care and they do work hard, but there are always ways to improve and grow. And I think implementing this strategy of growth of specialized care for the community that surrounds them, that is clearly aging and only going to grow in that age group due to retirees or due to every year goes by. The strategy is one that is a long-term beneficial strategy for Novant Health to take. End of my slideshow. I hope you don't have any questions. I hope I was very clear in how I explained everything, but if you do, let me know, and have a great day.